Other than that, what have we done that is positive as far as these independence accounts are concerned? Are they bearing great fruit, or is the sole purpose to find out who did not claim back or whose cards were returned?
Stephen really analyzed this area, but from my standpoint, I don't think that you can say that one way or other what impact it's been having. But
is it reducing costs?
I can't answer that right now, but it's not certainly not. It's not clear.
It's not increasing efficiency.
I could check into that in the future, but we haven't looked at that, so I want to be careful not to say something that is not accurate, because that's an important question. I think that the problem is the way the account is structured, Senator. It's not really, and when we talk to the CEO and his team, it's not really proactive and personal. It's not real personal responsibility driven. So there really isn't a lot that I think you're going to see out of those accounts as far as personal responsibility, taking action, really making changes in behavior. But I want to be careful because we really haven't analyzed that.
That would be helpful to me.
Okay.
Because if we're going to have programs in place, then there needs to be some mechanism by which we can judge rather than just having programs in place. The other thing that's concerning me, Mr. Chair, is not just Stephen, but to you and our co-chair, is the number of committees that we have working on this issue. There are a plethora of committees that are dealing with the same thing, and I'm saying Stephen at Peer and Mr. Seeley at Peer, I'm seeing them at JPR, I'm seeing them at Health, I'm seeing them at the Marketplace, I'm seeing them here. And you begin to wonder when do they get a chance to do the job that we have put them in place to do. So is there some plan then to coordinate among this I just like to see us all meet together, because we cannot continue to push past North Stephen to 15 different committees and hope that we are going to have efficiency. So that's my concern.
It's a valid concern, and I had a conversation with Richard and with John since our last meeting about multiple requests that have come to them to go to different venues, to come to different meetings. And after discussion with DLR staff, it needs to be clear to the task force. I know it's clear to John that they are engaged by this task force and DLR, and anything that distracts them from accomplishing the task and the scope of work that they've agreed to, they're not going to do.
Thank you so much.
And again, I think we've and again, there are going to be some things when it does produce value, and they will go to other committees if there's contracts that they have questions about that are inside the scope of work. But as far as they have gotten very clear direction that their function is to work with the task force and not to be dragged off on other areas.
Well, I appreciate that, and I do hope that Sunshine Grass Hill Public Health and this community.
Well, and I think we'll talk about that. There may be a desire in August. The governor's going to come and want to address the task force, and there may be a joint meeting with the governor's steering council, and there may be an opportunity for the health. As I said, there's going to be a lot of interest in some of the meetings that we have, and if we want to make those joint meetings, so long as we coordinate what's going on, I think that might certainly be appropriate, because we don't need to say everything, make them say everything 3 times.
That's so true. And finally, the one element that I'm finding missing is the disparity impact of health care on minorities. And I hope that at some point in time I can visit you and Representative Collins about bringing in some individuals who deal specifically with minority health. And I would like to get with you to discuss that, because I think that has been a part of the conversation that is missing. And it is a relevant part of it.
And it was displayed quite clearly when we looked at the geospatial data that we got and how there is such a disparity on different parts of the city and different parts of our state. So it certainly is relevant, and we will have a hearing on it. You bet. Dr. Bledsoe.